Hi, my name is Missa Crow, and I'm the Senior Director of Sales here at Ntracts. I've been in the healthcare contract lifecycle management space for a little over 10 years, where my day-to-day role is speaking with hospitals and healthcare organizations across the country on how we can help them manage their contracts and contract compliance. Today, I'll be talking about the top hidden fees of contract lifecycle management implementations gone wrong. And on this topic, it's specifically discussing organizations who have either migrated from no contract management system or a competing contract management system, or even a good old SharePoint spreadsheet type system, really just the specific costs that can be tied to implementing different solutions and how Ntracts can help. So we'll start with the different types of implementations. Typically, organizations are using one of a few systems, a homegrown system, so a shared drive, a form of a spreadsheet, some way that's keeping track of their contracts, critical information around expiration dates, auto renewals, and ultimately just who they're working with. We'll also see organizations move to Ntracts from what we would consider a competing system, so your other contract lifecycle management systems, and a lot of systems that are specifically what we would categorize as industry diagnostic, meaning they're not healthcare specific. They're just in the contract management space, so they work with multiple industries. In my discussions with hospitals and health systems, we walk through the solution and how we can really help. But a huge component of that is really the front end piece of implementing a contract management system. There are a lot of tools out there that can do a lot of important things, but if you don't get the implementation right, if you don't get your information into the tool appropriately, if you don't have a team to support you that understands your space, understands your contracts, understands your processes, and ultimately understands the regulatory components that are tied with your contracts. So whether that's the OIG, Joint Commission, D&B, you name it. So in today's discussion, I'll be talking about some of those hidden fees. Every contract management tool has a price tag to it. Some are high, some are low. You get what you pay for in a lot of those instances. But there are also a lot of hidden costs that can be associated with implementing a contract management system that may not be disclosed upfront. So some of the key elements and key areas that I'll be discussing today are types of implementation services, technical resources, support, and potential limitations in those areas. So some big questions that you may want to consider when you're evaluating a contract management system to start is what type of implementation is included. There are a lot of tools out there that will give you a tool, but it's up to you and your team, your resources, your time, your dollars to actually implement those solutions. It's really common in my discussions with healthcare organizations. If you're legal department, if you're in supply chain, no one has additional time to do these types of things. And you want to be doing your day-to-day. You want to be working at top of license on your specific role. You don't want to have to take the time to find contracts, load them in, make sure they're loaded right, train your users, build the system. It really is better suited to hand that over to someone who has more of the expertise, and it's also going to streamline your timelines. So when we talk about the types of implementation services that are included, we would advise to really dig into that, right? They may say a solution may say implementation is included, but what does that mean? Does that mean that we're going to show you how to use the system and it's up to you? Are we going to provide real resources to come on, maybe even come on site and scan paper contracts, maybe help you sort through your existing electronic contracts? So maybe we have all of our documents in a shared drive, they're not organized appropriately. We really need to make sure that we're getting all those organized prior to them going into a system, or the tool's really not going to matter. So just some big questions to ask. The build out of the tool. It's nice to be able to build some things as an administrator of the system, etc. But is your partner going to help you build out your workflows, your repository? Is their ability to customize it? So a big part of the implementation obviously is designing the system around your contracts and your process. Oftentimes a lot of tools are really configurable, but you still have to do it. You have to design it, you have to build it out, you have to know what you want. And oftentimes in those scenarios, you're ending up having to resource that out to a third party or a consultant, which obviously has big dollars tied to it. So a big value of working with Ntracts being that we are 100% dedicated to healthcare, but we also are supporting you fully through that implementation process and incorporating best practices along the way. So we've been doing this for a long time. Ntracts was originally founded in 1987 by Horrender. So we have that just healthcare foundation to our system, even from the beginning, but we're bringing that to the table during the implementation process. So as we're building out the tool with you, so first off, we're building it with you. You're not having to do it. As we're building it out with you, we are bringing to the table best practices. We have worked with and implemented over 2,500 healthcare organizations across the country to help them build out their system. So we bring to the table also, here's what other organizations are doing in their system. Here's what's keeping them up at night. Here's the regulatory impact on some of these components. And here's our recommendations. You all still, of course, get to decide how you want your tool built, but it really makes a huge difference in building out a system if you want to make sure that it's set up the right way. So some big components that we're providing and some big questions that we would recommend asking as part of your evaluation process. And in addition to that, are there fees for that? A lot of times organizations will charge a separate implementation fee to implement a contract lifecycle management system. Ntracts is not. It's a big value add with us. We do not charge for implementation or training for that matter. Training alone, as I'm sure a lot of administrators who may be watching this video can attest to, it takes a lot of time. It takes a lot of time to sit down and train a user and continue to provide educational materials or build out the educational materials to give your end user. Ntracts takes that heavy lifting off as well. We will provide the training for your team. We will train based on the role. So an administrator of the tool that needs to do so many things in the system does not, or needs that high level of training. Someone that just needs to come into the tool and view contracts or request something, that's a much simpler training. We provide educational materials as well. So to be able to reference our reference guides. Again, all of those things take time, they take resources, they take money on your organization. We take all of that off. So as you're evaluating solutions, not only what implementation services are included, are there limits to that? So sometimes organizations will say, we'll help you with implementing, but you only get X number of hours of support from us. If you go over that, then there's an additional fee. I talk with healthcare organizations all the time where they are blowing through those hours before the implementation is even halfway done. So those are additional costs. You're already in it, so you kind of have to keep going. And it's additional costs that weren't planned for, budgeted for, that you now have to do. So again, some big areas to look out just around implementations as a whole. Another big component is who is doing your implementations. Are the implementation services outsourced, meaning they're outsourced to a third party? Maybe it's someone that doesn't understand the healthcare space, but maybe they're just really that IT support. They don't have the consultative type approach to building out your contract management system. Again, good data in, good process in, good data, good process out. We want to make sure that we get it right on the front end and then put it into the system and let the system do all the amazing things that it does. But if you put the wrong process in, you put the wrong data in, the tool really doesn't matter, right? So it really makes a big impact on the initial implementation process. Once we've understood who's doing our implementation, what level of expertise do they bring to the table? Are they maybe just bringing that IT support, which is needed obviously in a technology implementation? Or do they have that expertise in your space? So specifically for us, our organization is designed for healthcare, 100% dedicated to healthcare. We also have a 100% implementation success rate. So really proud of that. That's hard for a lot of organizations to say. But specifically the individuals that are implementing your system, do they understand contract management? Do they understand healthcare contracts? Do they understand the difference between a physician contract and a vendor agreement and a payer contract and a lease? Do they understand the impact of the regulatory requirements that are so different for each of those things and all of the different processes that have to be followed, the standard policies and procedures that have to be incorporated? Making sure that someone understands that expertise is going to help make that implementation not only run smoother, but it's going to, design-wise, it's going to match your process. Your end users are going to be happy because the tool feels like they designed it because they did, right? They were involved in the implementation process and our team really helped guide that initiative. Specifically around the expertise, as I mentioned, the implementation team who's provided with that, the expertise that's brought on for that initiative. Another component to really pay attention to during your implementation process is what IT resources are going to be needed. Is the solution you're considering an on-prem solution or is it SaaS-based? IT teams are constantly working on big initiatives, large projects. It takes a lot of time, as I'm sure you all can relate to, that to implement any type of technology, making sure we have the appropriate IT resources involved or just our appropriate internal resources involved as a whole. So a lot of times those projects are going to have to be scheduled out. IT's busy, they have a lot of projects. We need to make sure the right risk assessments are done, which obviously most organizations should be happy to do. But as far as the build out of the tool, what IT resources, what technical resources do you need? Big value with Ntracts is we are very, what I like to say, IT light. Obviously IT is more than welcome to be involved in our implementation processes, but we really take the heavy lifting off of your organization, not only from your legal compliance purchasing teams, whoever's managing the contract tool, but your IT teams as well. The minimal IT requirements that we need are IT's help with implementing single sign-on, which is a pretty straightforward implementation, but we usually get a lot of positive feedback that we really don't need much IT support. IT has enough things going on. Let us take that on. We provide the implementation support from an IT perspective during the implementation process and ongoing. So maintenance, all of that's done by us. Regarding implementation, I've talked about A, is it included, B, how much is included, and C, who's providing that service to you. Something else to think about during the implementation process around how much is included. I mentioned, are there limits on hours? Are there set costs for that, etc.? But as you think about ongoing support, what does support look like post-implementation, right? We provided you a solution, we got your tool up and running, and then once it's live, a lot of organizations, unfortunately, will say, kind of call us if you need us. There may be a help desk you can reach out to, US-based, maybe not. They may provide account management, maybe not. So the ability to understand who's going to support your organization moving forward. With the Ntracts solution, not only, as I mentioned, do we help heavily in the implementation process, but the support definitely doesn't stop there. We provide a client support advisor immediately post go live. That is someone who has been involved in the implementation process. So they understand your organization, they understand your processes, they understand your contracts. That person stays on immediately post implementation to help with the official transition onto Ntracts. We have found that is the most effective way to help with user buy-in, to be able to make sure that the tool is routing appropriately. We do a lot of proof of concept during implementation, but once real contracts are routing through, new users are in the system, if things need to be tweaked or changed or more education needs to be provided, that client support advisor's role is to help with all of that for a temporary amount of time post go live. We have found that it is extremely effective with user buy-in, and it is made sure that users like the system, etc., as it goes live. Post that client support advisor, the support doesn't stop with Ntracts. We have a help desk and account management team that are at your fingertips for anything that you need as well. I cannot say enough great things about Ntracts implementation support, but just support overall. We have a 98% client retention rate. We're really proud of that. And a huge component of that is our support. If you talk to our clients, that is the biggest thing that they will tell you, is that the support for Ntracts is phenomenal. We had a client tell us that it feels like that they are our only client. That's how well they're supported with Ntracts. So I can't say enough good things, but it's also something to really look at when you're evaluating contract management solutions, is what's the implementation support look like? We've covered that, but ongoing, what type of support do I get? Do I get support? Is there account management, help desk? Where are they located? What are the hours? How often can I reach out to them? Are there limits on reaching out to support? So a lot of organizations, or a lot of contract management systems, if they're capping the implementation hours, they're probably capping the support hours too. So something that you should consider as you think about how much support am I going to need? Is it going to be a hidden cost that I'm not accounting for? Making sure that we're really understanding that before we make our decisions on a contract management solution. So ongoing support, help desk, it really, again, makes all the difference in the world. If a user is stuck in the system, they can't figure something out, it's going to not help with user buy-in, right? If a user is frustrated, they can't figure something out, they need someone to be able to help them. We provide training to the system administrator at your organization. So they should, a system administrator, or depending on how large your organization is, multiple system administrators should be available as an internal resource. Again, we provide resource guides. Again, our team builds those. You don't have to build them. A lot of times those resource guides will also be linked into an intranet. So maybe it's even part of your onboarding process. So being able to even have that part be associated, but making sure that that user feels supported, it makes all the difference in the world with that user liking the system and making sure that you have that user buy-in, which obviously trickles downstream. If users are using the system, it's making us more efficient. It's providing us that ROI. How many days are we saving just not having to answer a million phone calls of where are my contracts? How do I do this? All of that's supported by Ntracts. We build it out with you to really make sure that you're capturing all of that important information. Again, really impactful information and really some just big topics as you're considering contract lifecycle management solutions. Not every solution is the same. Not every tool has the same exact functionality, and every organization is definitely not providing the same level of support and expertise. So really just some key elements to really look at your contract management initiatives and make sure that we're really looking at the whole picture from a cost perspective, from a resource perspective, from a timing perspective, and just making sure we have all of our questions answered as we look through the system. If you have any additional questions about Ntracts and how our implementation process works, what our support team looks like, or even just overall information about our expertise in this space, we'd love to talk with you. Thanks.